Hi, let's look at the top updates from coronavirus experts for March 19th. So, one of the articles that has been making the rounds is a preprint academic article, a serological assay to detect SARS-CoV-2 seroconversion in humans. This is basically laying down the framework for a blood test. And the reason it's going to be important is because right now there are tests for the virus itself, but a blood test will help you recognize if someone has been infected and then recovered. And that means that if they're immune, then that means they can go out and participate in society. Or they can even be a healthcare worker who can participate in medical interventions without risking contracting the virus and spreading it to others, their colleagues or patients. Next up is an article from the New York Times based on CDC data, the Center for Disease Control. It shows that nearly 40% of patients sick enough to be hospitalized in the US were aged 20 to 54. So even though the risk of death was significantly higher in people who are older, it doesn't mean that young people don't get sick enough from this disease to be hospitalized. So it's not a good time, don't take the risk. Let's see. Another academic paper estimating clinical severity of COVID-19 from the transmission dynamics in Wuhan, China. So what they have calculated in this paper is that the overall fatality risk, and they've defined it here as the probability of dying after developing symptoms of COVID-19 in Wuhan, was 1.4%. And again, those who are younger are less at risk of fatal outcomes, and those who are older than 59 years old are at much greater risk. Okay, and the final article that's making the rounds it's another write-up about the CDC report and comparing various countries. It breaks down group risk and shows that younger people are not invincible, even though fatalities are more prevalent among older generations. All right, that's it for now. We'll return with more updates tomorrow.